Hi, I'm Dr. Chris Dougherty, a sports medicine fellowship trained orthopedic surgeon at the Agility Center in Bentonville, Arkansas. Here we're going to demonstrate an arthroscopic distal iliotibial band lengthening. We've created our standard portals for arthroscopy utilizing a standard lateral medial portal. We've also created an additional portal at the proximal aspect of the field, often where a normal inflow portal might be. We're outside the capsule. Above the IT band, you can see that we've got some bursa and our iliotibial band that we're identifying. We're going to mark with a spinal needle to ensure that we are at the level of the lateral synovial fold. So this is inside the knee, and there's our lateral synovial fold. If we were to try and do this from inside the knee, we would simply go through the capsule right there at the synovial fold, and the IT band would be directly adjacent to it. In this case, we're trying to save the capsule. So here we're going to liberate the IT band off of the capsule with the aid of our radio frequency probe. And we're simply going to Z-cut this. So we're going to go inferior to halfway through it and then come distal or towards the camera and then go inferior again so that we have two limbs. So now we've got our Z lengthening. And we're going to go ahead and clean up the bursa between the capsule and the IT band and all the adventitial tissue so that we've got excellent IT band release. And we can go ahead and do our Z lengthening. So you can see here inferiorly we're probing, getting all the bands released, and we'll do this up to the level of the epicondyle so that we don't have any adherence and our IT band is nice and free. Once we debrided all of our bursa, we assess our limbs for repairability. I do have a spinal needle placed here as a retractor, and so now we're going to bring our inferior limb of our IT band Z cut and bring it towards our proximal limb. We'll go ahead and place a cannula, and here we're just utilizing a standard suture passer, and we'll pass suture through each limb and then tie with simple surgeon's knots. You can see how thick this tissue is. It holds the suture very nicely. In this case, I chose O suture to try and get a nice lower profile knot stack. So with the cannula in place, it helps keep the space open, allows us to get our good visualization. And I want to make it very clear that you need to clear off the adventitia beneath the IT band proximal up to the level of epicondyle so it's not adhered there as well. But we're also taking great care to ensure that we are distal to the patellar ligaments because we don't want to disrupt the patellar ligament complex and result in instability. So here we've lengthened our IT band distally. You can see that the capsule is still intact beneath us. And then we'll drop back inside the knee. Looking lateral, you can see our spinal needle, its previous puncture hole. We're at the level of the lateral synovial fold. And we have lengthened the iliotibial band without violating the capsule. And then we're going to drop back outside the knee, and you can see we have a simple three-portal technique utilizing our standard lateral portal and a proximal portal.